Ladies and gentlemen, this session is how COVID-19 and social change altered the role of CEOs. Please welcome Linda Apsey, President and Chief Executive Officer at ITC Holdings Corp. Wright Lassiter III, President and Chief Executive Officer of Henry Ford Health. Cindy Pasky, President and Chief Executive Officer of Strategic Staffing Solutions. Garrick Rochow, President and Chief Executive Officer of CMS and Consumers Energy. And to moderate the discussion, Rick Albin, political reporter at Wood TV8.
Good morning, everyone, and thank you for being here. Take a moment to thank the Chamber, because it is always a pleasure to be able to come up here and talk with people who have the insight and the knowledge that know some of what makes our businesses tick and some of the challenges that we face. For me, it's always a learning experience, so I appreciate the Chamber putting together this great panel and once again having me be a part of what is a really, I think, very successful meeting here on Mackinac Island. We should give the Chamber a round of applause because they've done a great job with a really quick turnaround. So the question that we're going to examine is the changing role of CEOs. Now, for those of us who aren't CEOs, and I must admit I remain surprised I haven't been asked to be, but there's still time, and I'm open, by the way. But we might not think about it, because we spent a lot of time during this conference talking about the changing roles of how do we find people to work? How do we attract talent? How do we keep talent? How do we have to engage with employees? A lot of that's changed for a lot of you in your businesses, but the role of the CEO has changed too. And we're going to look at this in two pieces. We're going to talk about how it's changed post-COVID. And then the second half, we're going to talk a little bit about how it's changed with a new social awareness in our country, and I would say around the globe, and how corporations and CEOs in particular may be addressing that issue. So I'm going to start with you. Talk a little bit, if you would, and please describe your business for anybody who might know, and talk a little bit about what your role as a CEO is like today that is different than what it was like in February of 2020.
Great, thank you and good morning, and thank you, Rick. For those who don't know, ITC Holdings, we own, operate, manage the high voltage electric transmission grid throughout most of the state of Michigan and 6-7 other states across the Midwest and Great Plains. So for those of you who heard Ted Koppel speak yesterday, he was obviously addressing our industry, our business, so certainly keenly interested in his comments. So certainly, yes, I mean, the role of a CEO has drastically changed. And I know we'll get in a minute to, certainly some of the social awareness and social justice issues that certainly, we now all have to consider. But I think specifically maybe a little bit of perspective just on sort of from a COVID perspective, certainly as a CEO and for all of us, right, unprecedented, making decisions that certainly we didn't have playbooks for. And so really, connecting, if you will, your business fundamentally to your values. And certainly in our business, we operate high voltage electric transmission equipment, safety as our number one value. And so much of our focus and our efforts around safety of our employees, safety of our community, really helped us, I think, effectively manage through the pandemic as we kept coming back to COVID, or we kept coming back to safety. What I would say is, when you kind of look at what were our other values about being better together, and certainly as a CEO, biggest concern is we sent everybody home during COVID. We still had responsibility to operate the electric transmission grid 24/7. And, at that time, right, it really was, how do you continue to operate, do it safely, keep people protected from COVID? And so what was amazing from my perspective, and I think that really has now sort of transcended everything that we do, but certainly as I think about being a CEO, really coming back to that being better together. Even though we were apart during COVID, being better together. We, for example, we took over a local hotel for our transmission operators. We basically, other than the manager of the hotel, it was strictly our control room operators. And we did that, we sequestered them for the better part of 6 to 8 weeks. We kept them away from their families. They had a hotel room and then they went to work. They were around no other people. We sequestered a chef to cook for them. We sequestered the security personnel, and we kept them in a bubble for the better part of 6 to 8 weeks. But what was amazing was the other employees, right? They left families at home right in the early days of the pandemic. They left families, they left young kids at home, and our other employees stepped up to take care of their families. And I think through that, I think what we've taken away, what I've taken away is, when you're in crises, right? And we all know, right? COVID, we all have different perspectives, different opinions. What was so important, I think, was using crises to bring people together and really connecting it back to our business, our purpose. What do we do? What are we responsible for? And that guides, our decision making. It guides who we are, how we show up in everything that we do. And so now, when I think about being a CEO and how my role has changed, I connect back to our employees and taking care of each other, taking care of our communities, focus on safety. It's all about sort of being one collective team in what we do, but at the same time, recognizing, we all have different perspectives and different opinions. And while I might have my own beliefs and opinions, I recognize those aren't everybody else's. And I think COVID really brought that to light from a CEO perspective, is that, you have to engage and you have to connect. And I think in many ways, COVID brought us closer together in connecting, and sort of as a CEO, ensuring that you have to be always listening and connected to your employees and everything that they're doing so that you can make the best decision for the overall team. And that has continues to transcend so much of what we do and how we think about the work we do.
An interesting perspective, and it almost gives us a bit of a silver lining to what has been a very difficult period of time if you've been able to engage more with the people that you work with. I mean, Wright, in your situation, I can't imagine what changed running one of the major health systems in the country and having a pandemic. That must have changed where you were as a CEO quite a bit.
So I'd say yes and no. And so, to some extent, because we're in the healthcare business, it simply required us to lean in even more, and in some ways more broadly than we might have done before. So in that regard, that wasn't much different in the sense that we were used to managing crises. We were used to managing issues that sort of called us to come together. I think what was different, however, is that not unlike Linda, with our 34,000 employees, we did have those who were not in the clinical space who went virtual. And so we created this sort of we had this bifurcation in the workforce of those folks who are delivering care or directly supporting those who are delivering care that were still in the workplace versus those who weren't. Our organization, being a healthcare organization, I think probably had a higher expectation than in other industries around the connection of values to mission and purpose, and to some extent the voice that the organization would have on at least some social issues. I think what was very different, though, was the expectation that voice should be louder, that it should resonate more broadly, and that some of the public health work that we were called to do at times put us in positions that we might not have been used to previously, because those things might have been expected by state government, local government. Now those burdens were being thrust upon organizations like Henry Ford and the other health systems across the state and the nation. And then clearly, there was a demand for more transparency out of my office and our senior leadership team, and I think that was something that was unique and an opportunity. And I say it's an opportunity, not a challenge, but there was an expectation for more transparency because there were so many decisions being made at times so rapidly, and sometimes without complete information, especially early on in COVID. When you think about what's your primary responsibility, well, it's protecting the core. That means you're making sure that your team members are safe and that the environment is a safe environment. And early on, we didn't have a lot of answers. And so we were making, at times, decisions that we thought would create safety, and the staff wanted to understand why, given this invisible threat that we were facing. And then as more data came out, you'd have to pivot quickly and make another quick decision. And so there was a demand for more transparency because there were more decisions being made, frankly, sort of centrally than might have been in normal course, and certainly more rapidly than in normal course. And so that required a level of transparency. And then I would just say maybe the last thing I would highlight is that the COVID crisis demanded more humility. Because we had a number of conversations I did with members of our senior team and our senior team collectively about we don't have all the answers. And so we need to be more willing than normal to try something and be okay with the fact that it didn't work. And simply acknowledge it didn't work and then change course rapidly. And when I had that first chat with our chief human resource officer about our staff are facing challenges they've never faced before. And so your team is going to face challenges they've not faced before. And so maybe for the first time in your career, you should talk to your team regularly about we don't have all the answers, which means we need to be more humble about the prowess of the senior team, because we are generally always expected to solve problems. And the presumption is the solution you put in place will solve the problem. And there were times when the solutions we were putting in place didn't. And so that's where sort of the interconnection between humility and transparency was really important to be able to sort of acknowledge. We did a survey a few months into COVID, and we were expecting great results about all the amazing things that the senior team had done to support our team members. And we heard some positive things, but we heard a lot of, there is so much changing and you guys aren't communicating enough because we don't know where all these changes are coming from. And so I said to the team, so let's not get defensive. Let's just take it as an opportunity and just know that our organization is under more stress than maybe it's ever been, which just requires us to function differently than maybe we ever have. And so our best efforts may not be good enough, and that's okay. Let's just keep trying, and let's keep acknowledging what worked and those things that didn't, and then pivot on those things that didn't. And so I think a lot about, if you think about sort of the two major things that maybe COVID pushes us to do as CEOs, and that's firstly to sort of protect the core, and then secondly to think about how you have to pivot the organization for a new normal. And so we spent a lot of time in that protecting mode, but needing to sort of acknowledge that we've got to be more transparent than ever and be humble.
Great thought. The changing role of the CEO has got to be interesting, because you talk about humility, you talk about coming together, you talk about transparency, talking about being able to pivot. What if you have to work with 16 countries? We talked just briefly before you came out here, and it's not just dealing with changes and regulations here. Tell us about your business, what you do, and about that global impact and how your role has changed.
Wow, thank you. We do IT and information consulting. We're a little over 30 years old, headquartered in Detroit. Our international operation is close to 25 years old. It's headquartered in Lithuania, and from there we service 16 countries. And so part of what didn't change is we've always been a very lean, flat company. We have thousands of employees. And I've been a very outward-facing CEO who's traveled and communicated. So we drew upon that immediately, because that was what our team expected, our consultants. Years ago, it used to be a spreadsheet. Now it's an automated spreadsheet, but we can tell you by country the labor law, who the prime minister is, who's all of those things, how do you do those things. So we added COVID as one more category on that. And we took it in such a way that it will be ever changing. But when you work internationally, labor laws are ever changing, treaties are changing. When administrations change, whether it's parliament or things happen. So we already have that mindset that this will be the most important thing we now have to pay attention to, but we have to look at it the way we have everything else. And we were very, very honest with our team. And Wright knows this. He was gracious enough to let me interview him for our annual meeting this year. He was the most quoted individual in every single town hall that I did, and every communication that I did. He was, in addition to Paul and myself, the source of comfort for us three all around the world. But we were also very honest with our team. We said, okay, we haven't been through this before, so we're going to make this up as we go along. And many of you have been with us a very long time, and we're going to ask that you trust that we will make it up the right way, and we'll tell you when we're going to change. The challenge we had is that our customers are all A customers. They're energy, finance, and healthcare. So many of our consultants couldn't work from home. They had to be forward deployed. And we had to hire hundreds of consultants that April that were going to be forward deployed and equipped. Not just with technology, but masks. And we were able to figure out how to do that. But I think the reason we were able to do that is it played against the strengths that we had as a company for 30 years. So my role really didn't change. I didn't feel like it did. I felt that how I had always been CEO, this is what I did. And I will tell you, we were released to travel in May, and I traveled that first day to an operation because it was so important to us that if we had consultants that had to be front line, their leadership should be front line. So there was a core group of us that had permission. We were in our office every day. If you called corporate, the person that answered the phone could FaceTime and say, "We're here." So it wasn't easy at all, but it was a reminder for us. We have a very high retention rate, both with our overhead team and our consulting team, and it was a reminder for us that the manner in which we've run the company for 30 years, we had no idea that the payoff would be that we could keep people working. They would trust us enough when there were no answers to just keep their heads down, to do their jobs, to call if they needed help. So it intensified my role, but it really didn't change it.
Garrick, you have, like everybody here, folks who have to go to work every day that can't work from home. So when COVID came around, you have this big organization that's spread out across the state. How did it change your role? How did it change, if it did, change your approach? Because you don't get to miss a beat because then all of our lights go off. And that's not good.
You know, building off a little bit of the other panelists here, it was truly this leaning into our values. And one of our values is caring. And we talk about it, it's a word. We think we demonstrate it, but we really had to lean into that and be part of our safety. Before the pandemic, just a little story for a moment. Before the it was in March, before the shutdowns and other parts of the pandemic really took off, I was up at one of our service centers in West Branch, Michigan. And this is an electric service center. And if you've met our line workers, they're very tough individuals. These individuals, they go out when the wind's blowing, when it's storming, they're up on a pole, they're in a bucket. They work with electricity, an invisible hazard, every single day. Same with our gas workers, invisible hazards, they work with them every single day. So we had this briefing in our service center, I was talking with the crews, and then after, I had individuals come up to me and say this: "I'm not concerned about COVID, but my daughter, she's immune deficient, and I'm worried about her." Another individual said, "I'm not worried about COVID myself, but my elderly parents live with me." And here are these people that I've viewed as really some of the individuals that go out in any conditions, and very rugged individuals that serve our customers. And again, work with invisible hazards, and here the unknown was concerning. At that point, I knew as a leader, the game had changed. Because we We weren't going to be able to stop serving electricity or serving gas. That was not an option. So how were we going to ensure and really care for those individuals? And so they feel comfortable and confident to be able to go to work and not worry about their daughter or their elderly parents. And that was, it changed the way we thought about the pandemic from that point forward. And just how we brought ourselves into the conversation to care for our coworkers, make sure they went home safe every day, whether that was safety supplies. We spent all our bucket trucks home. We had to get special permits. We had to work with the Michigan State Police and the state of Michigan to be able to run those trucks on different roads. We did all kinds of things to keep our coworkers so they could be separate, but still come to work to serve our customers. And so that piece of caring was really important. And then to build off what Wright said, this genuine, we had to up our communications, talk more, but just being transparent. Like, there's an expectation that CEOs and senior leadership teams have the answer. And they just tell us the answer, you've thought about it, you've done all the detailed analysis, just let us know what it is. And we were in a time of unknown, so being transparent, being humble. 40% of our workforce is union workers. And to connect with them, I brought in union leaders onto some of our calls because I knew they would relate with the union leader quicker and faster than maybe they would even relate with me. So it has to be like, set your ego aside and just approach us with humble transparency, because we got to move the organization. We got to move quick in terms of a pandemic.
It's a great insight from all of you, and all of you have a little bit different takeaway from that, and I suspect the same will be true with the second part of our conversation. In our nation, and I said earlier, I think globally, but particularly in our nation, the social awareness, social justice issues that have come to the forefront have been different in a number of ways, but it's different for CEOs. Because, and I say this as kind of a blanket statement, which is not going to apply to all of you in the same way, but perhaps in the past, as a CEO, as a big company, you might have been more comfortable being quiet, not being part of the discussion. But that's not possible now, because it is a broad discussion that involves you and your company's values and the way you approach some of these issues. I don't want to get this too pinpoint, because I want you to tell me, and I'm going to start with you on that end, we'll move back this way. How has that changed your role as a CEO and the way your company approaches engaging, social engagement?
Let me offer a little context too, and not to digress too much, but if you take the event with Disney in Florida, I think you can say, and you hear people like, that's a DeSantis issue, that's a Florida issue, that doesn't happen in Michigan. The reality is it does. It happens in Michigan. That pressure which you're communicating and sharing with us in the question is very real. And we've had it within the company where you have coworkers who expect the company to respond, you have outside influences that expect the company to respond, but you also have people of influence and power who are saying, if you take this position, we're going to make it really hard for your company. That exists here today in Michigan. So the pressures are very real in that CEO role. The way we've looked at it as a company is really twofold. And the first part's going to sound a little bit formulaic, but bear with me just for a second. One of the things we did about a year ago was look at a matrix of how we look at social type events. And so that one, we could really, think about how we engage as a company, and how it's not just a point of view of the CEO or the senior team, but how do we engage more individuals and leaders in that conversation. That matrix we're really trying to empower the organization, because often in these social issues, personal views start to come in as well. So that matrix offered a way of objectivity in the discussion, because we could see this is how we related to this event, how will we relate to the next event. And then two, it looked at how do we have a thoughtful and measured response, right? In some instances, it may just be a letter or a communication, an email that we want to have with our coworkers. In some cases, it may need to be more. But again, it allowed us to take a step back, not get into the emotions of what's taking place, and have a thoughtful response. So that's one thing that we've done. The other thing that I think is really important, and what we've tried to exercise, and I've tried to exercise within the senior team as well as the CEO, is often when there's a social event, there's a pressure to pick a side. You're either this or you're that. You're anti or you're for. And often in that moment, in a social event, we're dealing with the symptoms. And what is valuable from my point of view, is how do we have a productive conversation where we can get to the root cause? Often there's systemic issues, and we need to bring people together to have those conversations. And so occasionally we get pulled one way or the other, but how do we get to the middle where we can have people work together? Because then we can get after the root cause. And so that's a lot of where we spend our time and focus on some of these social issues.
I'm going to ask each of you to keep it about 3 minutes because we can't let the panel run long, but I'd like to know how this issue has impacted your company. Again, you're dealing with it around the globe.
So we have traditionally over 30 years, we've been pretty vocal. I think a lot of people in the room would agree with that. But we do have an org chart. It's an upside down triangle. It's the only org chart I see in business that never changes because it's customers, consultants, and community at the top. I'm at the very bottom, as I should be. I service my leadership team. They service the field. They service the whole reason why we have a purpose. And so when we're pushed to respond, asked to respond, called out because we haven't responded, the thing that I start with is, as CEO, my number one priority is to make sure that S3 is successful in every place in the world that we do business. Because when we're successful, we create jobs, we make money, which gives us resources to influence, to support, and to care. And if we choose to not speak on an issue, it's because I feel the environment will not allow us to speak on an issue and have our opinion be respected if it's not agreed with. And I will never make a statement on an opinion that would hurt the ability of S3 to be successful. No matter how passionate I am personally, I'm a CEO responsible for 1,000 people that need to stay in those jobs, and equally responsible for customers that depend on us to have those individuals stay on their jobs. So you have to, and when you're around the world, a statement that I would make in Lithuania is probably not going to be received the same way that it would be in the Philippines. So not only do I have to look at the environment that we're in, but I have to remember that my first job, not as Cindy Pasky, not as a Detroiter, not as a Lithuanian, my first job is CEO of a company that employs thousands of people. It's to keep them in those jobs and to service the customers that trust us to have that talent there. And then within that, use our success and use our resources to see where we can have a voice that will make a difference in how we do that.
Right. Has it changed the way you function as a CEO and consequently within your large organization as people are more interested in social justice and social awareness?
Yeah, so I think the short answer is it has changed a bit. Not unlike what Cindy just said, as the CEO of Henry Ford Health, my job is to ensure that we accomplish our mission. And the three most important words of that mission is improve people's lives. And there's a little more to it, but that's the three core words. And so we can think about that narrowly, or we can think about that broadly. It can narrow just in terms of delivering healthcare, or more broadly in terms of things like equity and justice. And then so my thought is, and then our rules of the road then ends up being our value system. And two of our core values that relate to this: compassion and respect. And so I think the short answer is our organization has expected my voice as the CEO of our organization to be louder in the last couple, 2-3 years. And to some extent, I antagonized a bit of that expectation as I wrote a letter of reflection to the organization after the George Floyd incident. And the question that I asked our organization is, are we doing enough? And a commitment that I made to the organization that we would really spend time critically talking about, are we doing enough, including am I doing enough as a leader of the organization, and if not, we do more. And so we, through conversations with leaders across the organization and the board, made a commitment that we needed to do more. And so our board adopted a new strategic plan that sort of elevated our efforts around not just diversity, equity, inclusion, but we, for the first time in history, added justice to our efforts and had some very comprehensive conversations about what's our role and how do we ensure, if we want to take on a broader social justice voice, how do we ensure that it doesn't distract from the core, which is ensuring that we deliver high quality health care in a compassionate way to anyone who we can service across the state. And so it's caused me to just frankly think more critically about how and where I spend time, how we communicate transparently to the organization what things are important to us. And not unlike what Garrick said, that oftentimes it's not about necessarily taking sides, but it's about determining what is the problem to be solved and advocating for a solution to the problem, as opposed to we're going to pick side X or side Y, but we're critically focused on the problem at hand. Just a quick example, I sent a note to the CEO of St. Francis Health System in Tulsa this morning, where there was a shooting with 5 individuals in a clinic. And so one of the things that we're spending a lot of time on is how do we address this issue of violence in America's hospitals? And it's not necessarily an issue of, gun control per se or amendment this or that, but everyone can agree that there shouldn't be shootings in healthcare facilities, or there shouldn't be violence against healthcare workers. And so how do we advocate for solutions to that without necessarily presuming that it's a Democratic or Republican issue, but it should be a bipartisan approach to eliminating violence in America's hospitals and health systems. So, one example.
Great current example. So we're really tight on time, so I'm going to ask you to do this in about 2 minutes, if you can.
Sure, great. Yeah, look, I agree with all the panelists in terms of sort of the perspective, and I couldn't agree more. I think we have to be thoughtful and measured. I don't think we have to weigh in on every single issue. Our employees, our communities are reflections of all of us. And, when you get, I think, if you start to take sides, you're going to automatically isolate, let's just say 50% of the population. However, corporations do have a really important role. And I think, with the George Floyd incident as an example, corporations have really leaned in and we are making a difference. And, I'm a big believer, actions speak louder than words. And I think it's much more important what I'm doing, what I'm leading, my team is leading. For example, on inclusion and diversity, we're all on a journey. We've made substantial progress in terms of, our focus, what we're trying to accomplish. And I think that is much more important than my name on a headline in the newspaper in terms of what my opinion is. And so I really believe actions speak louder than words. And, but there is a space, there's a place, right? We are reflections of the communities we serve. We're reflections of our employees. And, I do think we can make a big difference around these, equity and social justice issues. But it comes back to what are we doing about it, not just what we're saying about it. And that's, kind of how we've thought our way through how to be engaged, involved, as a leader. We haven't really touched on it here, but certainly I think the last 2 years has taught us all to be much more empathetic, to shut up and listen. And so, really engaging with employees, listening, being empathetic to the different perspectives, and then finding your way, through being an empathetic leader has really made a difference for me personally, but for the organization as well.
You all have made it a pleasure to shut up and listen for the last 30 minutes because each of you has such a wonderful perspective and it comes from a different place. I thank you for spending your time with us, but more important, I thank you for bothering to think about these things, because for all of us in the room, we have to deal with them in some way or another, and maybe you've given us some tools. So thank the panel, thank the chamber, and thank you all for being here.
Ladies and gentlemen, this session is sponsored by Ralph C. Wilson Jr. Foundation. Please welcome.